So there are 4 types of nursing diagnosis. 1 is problem focused. 2 is risk. 3 is health promotion. 4 is a syndrome, right? This is similar, but slightly opposite to the primary, secondary, and tertiary, health promotion that we were doing in like the 2020s. It's about when we're doing medical diagnosis, what's going to kill them first? I don't know if I can say that, but what's going to kill them first? Literally. All right. So 1 is going to be the problem focus. The problem focus could be cardiac output. Every time this individual gets mad, he's, right? So he has cardiac output issue, and that's how we're going to put it when it comes to the hierarchy, right? I'm talking about hierarchy as well as. Second one is going to be risks. This person is at risk for falls. Everyone loves risk for falls. See how important it is, right? Prevention. 3, health promotion. Health promotion about brushing your teeth every day. Hey, did you know that if you, don't have cavities, you're at least risk for, the bacteria to go into your brain? Hey, let's prevent cavities, like situations like that. They're like, oh, I didn't even know. 4 is going to be syndromes. Syndromes is sometimes a list of symptoms that doesn't exactly mean that it's a disease process, but these individuals, there's a demographic, right? There's a demographic. A good example would be like Raynaud's syndrome, right? There's a Raynaud's disease. It's a circulation issue where some individuals, if you look at their hands, it'll start to turn like really white on the tips of it because the circulation gets cuts off. And it doesn't sound too bad until people start to lose their limbs because of the loss of circulation, right? It's usually a hyper effective reaction that your body does, which is too unnecessary. And then that's when it does that. It's like kind of attacking itself. It's not a good thing, right? So some individuals that have the Raynaud's disease, we know how to treat that. It's a disease process. Okay, give this medication or something like that, prevent ABC. But if you have a Raynaud's syndrome, you don't exactly have that cardiac issue. You don't even have the markers that would scientifically diagnose you as this. But when you smoke or something, or when you get upset, you seem to have these situations. Can't call it anything else because that'll be wrong. So we're going to call it the syndrome. And we'll just treat you a little bit slightly different, understanding that this is the path that you're on, right? That's the best way I can describe a syndrome. Okay. I'm going to leave this here, but soon enough, I'm going to erase this part if you can even read it. Okay. So 3 main components of nursing diagnosis are the problem and the definition, right? Let's say it's renal insufficiency, or let's talk about cardiac, like hypertension versus heart failure or something like that, right? First, we got to define the problem. Is it hypertension, or is it worse than that? Is it heart failure? Is your ejection fraction rate 25%, 50%? If I'm losing you guys, feel free to ask me, like leave a note and we'll talk about it later, right? But yeah, so if they're having hypertension, is it hypertension or is it heart failure? Left or right heart failure? Let's look at the labs, ejection fraction. Cool, we found a piece of our nursing diagnosis. The second one is the etiology. What exactly is the issue? I see that every time they talk, they have like this pulsing thing, or I see that their eyes are getting red, or I see that their ankles are swollen to the size of watermelons. What can this be? Hypertension. Symptoms of hypertension. All of these that I just talked to you about. JVD, the increased pressure in your eyes causing the retinal, like the vessels actually pop in your eyes. And that's why when the cartoons show that like their eyes get super red and angry, it's literal. And then the last one's going to be defining the characteristics or the risk factors like I just talked about, right? Another risk factor is people that have hypertension. If they smoke, that might increase their risk. I mean, increase their pressure. Just things that you would know. Which it's funny because I had a patient there was a patient in a nursing home and he had hypertension, but he also had smoking issue. But in this nursing home, you can't smoke. So they would give him a nicotine patch or a nicotine gum or something like that. I forgot which one it was. But they knew that if I came up to them and they wanted me to give them like some clonidine or something like that to bring down their blood pressure, I said, I can't give it to you because your blood pressure is right now like lower than what the order says. Tell me how this person would go find a way to get like a nicotine patch or something like that, or use one of his, like, oh yeah, okay, cool. I'm not even gonna argue about that. Can I get a nicotine patch? When I come back like 30 minutes later, his heart rate is high enough to get that clonidine. I'm like, you got me there. You got me there. So I can't really go too far. So individuals already understand that about themselves. Same thing with diabetics. You know, you just need to understand the entire person's body. And sometimes you have to advocate because that person doesn't even know that about themselves. I had this one individual where he was living in the clinic with me and he would always come to the window to get his blood sugar checked. Always barefoot. Always barefoot. Why? Why are you barefoot? You've been diabetic like all your life. Anyways, so moving on to the next one.
Oh, I like her.
So now we're gonna do
Mhm.
the nursing process. We're gonna go to the fun one, which is literally, I need you to understand all the options that is at your disposal when you're gonna be using your nursing diagnosis. Because in Nanda, online, you can look up Nanda classifications. There's a taxonomy, which taxonomy just in general is the practice or the study of classifying, describing, naming. There's a taxonomy for animals, all kinds of stuff, plants. I love looking at that. But yeah, so there's a taxonomy for the Nanda. And for us, luckily, there's 13 domains and 47 different classes to choose from. Just all these awesome reasons to, you know, make a procedure. Right. So let's get started. I'm not going to write all of them down because you see, I'm not fast at that, but I am going to write down the titles and I'm going to name at least one or two of them. And if this is a domain that you actually like, then feel free to look up all of them. Yeah. Okay. Blue is the best color, right? Or red. I think red is a better color. We have 13 domains and 47 classes. Don't ask why I have a dry erase board. I had it before this. It's really good for planning. If you ever need to talk something out or something like that, if you talk it out loud, one, you're teaching yourself with the words, you're teaching yourself with the hearing. It's good to talk to yourself. Just don't respond. All right. All right. So we have health promotion. That one is like health awareness, health management. You know, there's something called anosagogia, and I just learned this in psych, and it means an individual's unawareness of their own problem. Like, let's say they have OCD and they don't even realize it. What are you talking about? I don't wash my hands every 2 seconds. I'm not hand sanitized. No, I don't have a problem. What do you mean? I'm like, ma'am, you're doing it as we speak. No, I'm not. He's talking about everyone washes their hands 15 times a day. Yeah, so that's health awareness. It's more serious than you might think on certain individuals. Like a diabetic that doesn't realize it's bad to eat cheesecake. Right, okay, so that's definitely one. Health promotion, health awareness, and health management, proper health management. Next one's gonna be nutrition. Because we all understand how serious it is about what comes into your body and how it affects your body. So health and nutrition, they can have a problem with indigestion. It could be absorption, digestion, metabolism, hydration, any of these things can be nutrition issues. I put hydration and definitely, let's say, metabolism. Okay, hydration, the easiest one, hangovers. That's a hydration issue. When you drink, your anti-diuretic hormone is suppressed, so you're urinating out. You're giving everything out. You laugh. That's moisture. You're crying, you're sweating, you're urinating, all moisture. Everything is moisture. And you didn't drink, not a lick of water. You know, what's it called? Water breaks when you party is really good. You'll be a cool friend if instead of you come in with all the shots, you're like, water break, you bastard, you drink something, right? Because I love you. Because in the morning, if you don't drink, that's where hangover symptoms come. Your photophobia, your inability to concentrate because your brain is so fuzzy because your brain is a raisin, basically, right? So hydration. The opposite of that, not exactly specifically, but the opposite of that would be diabetes insipidus. Diabetes insipidus not the same as diabetes mellitus, where diabetes insipidus is an inability to release your fluids. Oh, it sounds lovely. I love that. All right, everyone, can you mute, please? So diabetes insipidus, that's an issue where you're unable to release a lot of fluids and you're obsessed with water. These individuals will actually be NPO and they would be crying like a prisoner. Please, can I have some water? I am thirsty. Why are you doing this to me? And I'm like, ma'am, you are so diluted that if I give you any more, you're not going to have enough electrolytes to actually do everything properly. Your heart might give out. You know, electrolyte imbalances are very serious when it has to do with potassium, calcium, anything, right? So that's why diabetes insipidus is actually very dangerous. It's actually kind of rare, but it'd be fun if you actually get to see a situation like that. All right. The next one is elimination. What goes in must come out, right? Elimination or exchange. When it comes to urinary function, of course, what goes in must come out. GI function, inability to digest and turn over what you take in. You know, some individuals, they're able to know this, the ones that are obsessed with their poop. Today was green for whatever reason. And I'm pretty sure us as nurses, we diagnose ourselves and we realize how our fecal matter, how our bowel movements change, the smell of it, the texture of it, everything, depending on the kind of diet you had that week. Even I remember one time I had a Popeyes week. Me in that bathroom, I was praying, okay? So all right, the integumentary, like your skin, there's a lot of medications that you can put on your skin. That's also very important. That's why it's important on what you put on your skin when it comes to makeup as well. Just a little tidbit on that, and why you shouldn't fall asleep with makeup on your face. And then the respiratory function. The easiest way of showing this one, I'll write this down. The easiest way to think about the respiratory function is a newborn preemie baby. That's like, you know, the safety is between 22, not really, to 36 weeks or what have you, to baby pops. But if you have a child that came out before 26 weeks, I believe, that's where their body has not been able to be given some of the final, you know, processes in the baby. I mean, during the pregnancy, which is the surfactant, right? Correct me if I'm wrong, but surfactant is a fluid. You know, you're supposed to have fluid in your lungs. No, this one is actually positive. It's supposed to be used to expand the areoles. Right now, since you're inside of the womb, you don't have to breathe, so it's all like this. And the whole process of oxygen to air, air into oxygen in the lung process hasn't even been completely done. The baby gets born, right? And now we're out here in the world, and he didn't get the last chapter of his class, so he's like, right. The story with that is I was in NICU. I was in NICU as a student nurse, and I was worried about asking dumb questions. Never be worried about asking them questions. Why? Because I saw this baby, huge diabetic baby that had to come out because he couldn't be in the mom anymore. So he's laying there looking humongous, juggernaut, right? But his breath is, and which is what's supposed to happen as a baby. But at the same time, when I was doing my nursing notes, I was like, that baby has too many problems. So I'm gonna go find an easier baby to do my notes on. I go find this other child, we're playing around, and then I look over and the baby that I was looking at, like even from across the room, it looks still. And I'm like, this is still early. You know, as a nurse, as a nursing student, if your nurse is supposed to be there at 6:30, you're supposed to be there at 6 or 5:30. So I'm just here, just having fun. And so I'm looking at this baby and I didn't know whether or not it was breathing. So what did I do? I looked at the machine and I'm like, oh, the machine's not going off. Never listen to the machine first. If anything, it's to verify, but you're supposed to be better than the machines, right? What did I do? I bypassed the nurse to nurse conversation. I don't want to bother you guys. And I went outside and I asked the front desk security, the one that prevents people from stealing babies. I asked her and I was like, hey, let me ask you a question real quick. And she was like, oh, okay. She closed her little, whatever book she was reading. It wasn't a textbook. It was like, just a book. And I'm like, what do you think about this baby? And she did the same thing. She looked at the machine and was like, well, the machine's not saying anything. So sounds like it's fine. And I'm like, oh, good. Yay. So now I'm sitting here and then suddenly, boom, in bursted a whole scene, a new baby, 3 nurses setting it up for a surgery for the umbilical cord, and the doctor that's supposed to have the surgery bedside is just waiting. He has a cup of coffee and he's like this. And here's the baby that I just verified with the security that she's okay. And he looked and said, this baby's not breathing. And just left, just like that. And everyone was like, what? And they started like smacking the baby. And then suddenly the baby went, ah, and did that whole thing. And then you saw the color I didn't know the color baby was pale until I saw the color come back. And I was like, whoa, I got to go sit down. I was like, oh my gosh, I shouldn't be here. So I was silently having a traumatic moment. But then I was like, I'll never be quiet again. I'm like, I have a question. What's that number mean? I don't care. You guys are talking? Cool. Let's talk about this patient. What does that number mean? Like I'm on it. I'm on it all the time now. So ended up what happened, continuing that story, after the lesson of always ask questions. What did they do? Right there bedside, they took the tool, opened up the child's mouth, found out the tube to go down into the lungs, and they poured in surfactant like immediately. I was like, I don't think you're supposed to do that, but hey, that was a doctor, so I guess what I did, I kept my freaking mouth shut. And I learned that day that surfactant is a liquid form and is poured into the lungs. Really awesome. Back into it. Next one. We have activity and rest. That's an individual's ability to rest, to exercise, to balance their energy, maybe even cardiovascular to pulmonary responses, or self-care. I'll just put self-care. This is usually for people that have a lot of children sometimes, or they have a whole school to deal with, and they're like, what sleep? What sleep? I'll dream when I'm unalive. Anyways, so this one is important. It's not even taken as seriously as it should in certain domains, but it is a real thing. People will collapse. Shoot, did you hear about the robot in Amazon? They bought an Amazon robot and they tried to replace the humans, and they worked the robot so much it collapsed. It literally, they can't use it anymore. Goodness gracious. So so that's just, it's important. Remember that. Sleep and rest. Also important for students. I used to be someone that had a full-time job at night from 10 to 6 in the morning. And then I had like a 30-minute nap. And then I'm back in school at 8 in the morning. And then for that semester, I was taking like no-dose pills. And I was literally like this in class. I was awake. I was not there. I was not there. I left myself in that bed over there. So yeah, just make sure. Oh, another important one, cardiovascular and pulmonary responses. This can be seen as a physical problem, such as like those kids that pisses off the dad, like in The Simpsons, and he wants to chase him, but he can't even chase him because he's like, oh, you darn kids. That's one thing. But the way I'm thinking about it is panic attacks. Panic attacks, crash out mode. You know, if you're a professional crash out, you already know. Like you can not even be an Olympian, but if someone pisses you off, you can chase a car. Yeah, you can. If you can, you don't have to be a bodybuilder, but if there's a car on your child, you're gonna pick that car up with you and Jesus, but that car is getting picked up, you know? But whatever. Cardiopulmonary responses, your whole body is a series of systems, right? So if your emotions get your cardiac up, and then your cardiac gets your respiratory up, and now you're having a hard time breathing, this is all under activity and rest. Calm down, you know, whatever. But is it that easy? All righty. The next one's going to be perception. Perception and cognition. This has to do with LOC, you know, attention, orientation. Patient has inefficient attention or whatever. That's literally ADHD we're talking about. Okay, sensation, perception. If you're diabetic, you have a deficit in what was it called? Sensation in your fingertips. Cognition, individuals that are kind of going into neurocognition, not dementia anymore, even though that there is that word still, but now they call it neurocognition, level 1, 2, 3, right? And then communication, individuals that sometimes have let me see if I can write this right. Sometimes they have a head injury. That's an N. They have a head injury, and their Wernicke's section of the brain is messed up, and now they can't even talk. Like they know words, they can speak, maybe they can write, but when it comes to finding the words, they're like, gosh. And also the Broca gland. So when it comes to certain head injuries, so perception, cognition, that's another issue. Why is that an issue? Fall risk. Back to the fall risk, right? If someone doesn't have good perception, and then you're like, okay, just get out of bed, they'll be like, cool. And they're gonna be walked right into the floor. So document. Oh, I never knew. Document that. Perception and communication. I'm about to delete this because I have a few more to go. We are on 6 of 13. Right? Okay. Next one is role relationship. Sometimes they have caregiver roles, family relationship issues, or role performance issues. Role performance, maybe imposter syndrome, you know? It's a real thing, I can say, because, or maybe mothers that feel like they have imposter syndrome, and it's like, it's too late, the baby's in your hand. You're like, oh my gosh, yeah, it's too late. So sometimes they have that. This is actually a diagnosis that nurses in the NICU, not only the NICU, but yeah, in the peds, in the baby realm, they have this individual, because there are sometimes mothers that are born not attached to their children. They may be having the postpartum depression, or maybe they have deep-seated issues with their own mother, what have you. But that's happened before. And that definitely needs to be documented, because a catastrophe could happen. And if even one person knew about it, it's a sentinel event and the whole shift is getting fired. Okay, so, but this is a good example of when I was a nursing student, I was in the NICU. I mean, not the NICU, this one was the baby, you know what I'm talking about, OB. So I'm going in, and this room is dark, and I'm assuming, okay, she's taking a nap, and the baby's crying. So I was like, oh, let me go and help with the baby. But she's not asleep. She's awake in her bed like this. And the baby's over there, and she's just looking like straight. Come in, and I have to ask, hi, I'm the nursing student. Is it okay if I, like, you know, help pick up the baby? Or maybe, and she was like, get the baby out of the room. Like, get the baby out of the room. And I was like, oh, sorry, what was that? And she's like, I don't like hearing that. I don't know. I can't get the baby out of the room. I said, okay, I got that baby out of the room, man. Yeah. So then later on, another nurse, because at the time I wasn't a nurse, she came in and she talked to her. She goes, oh yeah, she's definitely going through it. You know, her man's not there. She's feeling unsupported and she's going in a spiral. So her documentation was changed. They put the baby back in there, of course, because you have to, but more checks, more help, you know, making her feel like she wasn't alone. Some people, I thought the room was dark. I thought she was trying to go to sleep. In her mind, she was like, Jesus, please send someone in here. You know, role performance. So the next one, sexuality. We already know. That's to do with sexual identity, sexual function, sexual reproduction. Sexual reproduction could be erectile dysfunction, or it can be BPH, benign prostate hypertrophy, right? Or when it comes to sexual identity, you know, I'm a guy, but I want to be a girl. I'm a girl, but I want to be a tiger. You know, it's stuff like that. So the next one is coping. And I'm hoping I'm making this easy for you to remember and or understand, because these are things that you need to be able to see it when you're walking in. I want you to be in Publix and you look at the lady in front of you and you see her ankles and you're like, oh, venous insufficiency. You have to be like that. Do it to your cat, do it to your dog, do it to everybody, right? Okay. Coping and stress. Coping and stress. You don't have to be in the psych hospital to need help. Okay. I'm just going to say it like that. Individuals, anxiety is like everyone has it with candy. Everyone gets it with their morning coffee. You know, we just have to understand it. And in my mind, in my world, everyone has the capacity for hurt, damage, you know, killing, but they just need the right reason, right? Some people might have a higher threshold and some people might not. But my job, especially when I was working as a psych nurse, was to find out what yours was, because I want to make it home tonight. I'm not playing around. I'm not playing around. So if you end up having PTSD with water, guess what? I'm not going to walk around you doing drinking freaking water or something strange like that. But if you were to be able to diagnose this and say this to your friend, like, hey, boo, before you go in there, buddy has PTSD. Because if you don't, you'll be like my mother and like put in situations where you have to fight for your life in a psych hospital because, you know, they just locked you in the room and didn't tell you and just wanted you to figure it out at the moment. So yeah, coping as well. The biggest reasons why it matters to me when it comes to coping and stress is because it's like we're like Coca-Cola bottles, and bottling it up doesn't work out, and it's going to come out one way or another, right? So just try to make it come out more smooth, which is talking about it, going for a run, doing something else except for the explosion that everyone has the capability of doing. As a nursing student, when I went up and I was talking to people, they're like, oh, give them inspirational speech, you know, about how to make it. And you know what I said? It is okay to cry every day. It is stressful as heck. No one else understands except for your friends. And, you know, they're not here with you. So it is okay to cry every day. Imposter syndrome is real. I had imposter syndrome until I'm over here doing my hair. And then I get a phone call from the dean talking about, how you doing, registered nurse Teresa? I said, and then suddenly, you know, it clicked. I felt, oh, I have a responsibility now. You know, I can't not know what I'm doing. And even if I didn't know what I was doing, I'm going to read a book before I freaking come into this room, you know, because now it's no longer imposter syndrome. It's responsibility. It clicked in, you know, but then again, you just got to see where everyone's at. The last one, not the last one. We're not. I lied. We have 4 more. So life principles, someone's values, someone's belief issues, or someone's inability to have those This can show up in physical ways when someone's having a moral dilemma, losing sleep, can't eat. It affects your life principles. You know, you're over here lying to your patients, crushing their pills and putting it into applesauce, and you're like, wow, why do I feel wrong? Because it's wrong. If you're missing sleep, if you're missing meals, you're like, what's going on? But for some people, when you're in the tornado, you can't see, you know, or if you're in the painting, you can't see, you know, the picture for what it is. You need someone else to tell you what it is. So sometimes that's the kind of situation they're going through. Hypochondriacs have the same reason. I have the same issue. Hypochondriacs and Munchausen. Both are like a psych issue that is attention seeking, where they'll go to a medical professional and Munchausen be like, my stomach's hurting, I think I have cancer, or my head's hurting, I have a tumor, or like my eyes, it hurt when I looked at the sun, help me. I'm like, you know, that's Munchausen's. They just want attention from you because you're the medical professional and stuff like that. And then the other one, it's like, it's not as subconscious because they'll take something weird, or you know, they'll lie about it. They know they don't have something, but they'll still come into the hospital lying about it just so that they can get attention. Life values. Find something else to do, you know? Let's find something else to do. Let's find out. So safety protection is the next one. Safety protection of yourself. That's why whenever you're talking to somebody and they end up taking a dark turn, like, oh, so how's your life been? When I take care of, or when I'm assessing my patients with the methadone or opiate addiction, I say, how's your life going? He's like, oh yeah, it's going pretty good. My son's 9 years old and we're doing good. Oh, happy to hear that. Other times is, I don't know, man, life is just really going deeper down and everyone's upsetting me and like, it's just seeming harder and harder. I'm like, first question is, do you feel like you're gonna hurt yourself or anyone else? You know, anyone, me, people in the room? You know, like, let's figure this out right now, because that question from the patients that I've seen, I'm not like trying to be prejudiced or anything, but the individuals that were prone to danger in the psych hospitals that I would work at, they look like this, or they look like this. And I can't tell the difference. So you know what? Let me just ask and stop trying to be a mind reader. You know? So safety and protection of myself, of yourself, of that baby, of everyone. That can be also infection, self-injury, like the homeless man that I was speaking with, and I prescribed him what's it called, the HIV prep, and he was almost about to leave the room, and something just told me, just check the rest of his body. So I checked his ankle. He had a gash this big, and this man's like 47 years old. He's like, oh yeah, that happened a few days ago, I forgot to ask. So luckily I treated it and everything, but that could have been really bad, really dangerous if I left it. Sepsis. So physical injury, prone to violence, environmental hazards, defensive processes, yeah, and thermoregulation. Yes, okay. So the next one's going to be physical comfort, environmental comfort, and social comfort. Some individuals with agoraphoria, they won't go outside even to get the milk if they're that scared, you know? And if that's the case, then somebody might go in for a wellness check and find someone unalive because they wanted to not bother anyone so bad, you know, like just trying to figure out where they're at when it comes to their comfort level. And because the comfort level is also how comfortable you are with getting the things that you need. Closed mouths don't get fed, not always. Definitely not always. And then finally is growth and development. And that's the two, it's growth or development. If a child has growth issues, anything that doesn't grow dies. If the water moves, then it's a river or it's a brook or it's a creek. But if it stays still, it's stagnant, it's a swamp. Right? So as someone that is taking care of a living human being, any pause in the growth or development factor is scary for any of us. So that's definitely an individual deficit development because of related to no contact as a child, you know, insufficient growth related to malnutrition, you know, that diagnosis right there can end up having an NG tube. If an individual is unable to grow because they can't eat, they can't chew, they can't swallow, whatever the problems are, and they have a growth issue, yeah, we're gonna put an NG tube in them. We have to make them live, you know? So all of these diagnoses, these Nanda diagnoses, are your reasons and explanations and rationales on why you're gonna come and touch this person. You know, it's gonna be under one of these things. You know, Good Samaritan law, someone sees me on the floor in the middle of the day and I'm like straddling them and I'm doing this and they're like, help, she's robbing them. And as the police tackles them, they're gonna see my hands are not in their pocket. I'm like ripping open their chest so I can like do something medical, you know, so that would definitely save you. Look, what are you doing? I'm like, okay, you know, I have to see the heart, then the diagnosis, and it's all good. Or we're in the hospital and a nurse sees you walking into a patient's room with like a few syringes, and that's your patient, and you see them walking in. My question's like, hey, ma'am, buddy, what you doing over here? Oh, yeah, so they have, well, they have circulation issues because they have hypertension. So they sent me in here with like some Plavix. I'm like, oh, okay, cool, you can go in there. Go ahead, stab, oh, stab away. But if you don't know what you're doing, oh, I don't know. They told me to come in here with some potassium. Come out the room. Come out of the room, right? So that's the few things that I really need us to have in line before we go forward with anything else. When it comes to touching a patient, I need you to know what it is that you want to do, how you're going to be safe, how you're going to explain yourself in any of these situations, proper assessments, that you're not just doing it because you like to do it. You know, we need to have a reason for everything. This is under a license. Everyone here is protected, and they're expecting you to do this not just for fun, right? There's times that it's not going to be fun doing this whole assessment, but we're doing it. Oh, yeah. So back to the event that caused, not, but that's a good example for everything here. There was a giant news coverage of a skilled nursing facility, a SNF, called Colonial Heights. Thank you, Tabby. Called Colonial Heights in Virginia. 18 was charged and 16 arrested for abuse and neglect. And that can be neglect as in not turning them, not feeding them, not checking up on them, not giving them medication. Abuse as in be quiet, or you better take this medication, or get the heck out of bed. Anything. It could be, my mind is everywhere, right? But if some of these situations would fit into the role, okay, then it's understandable. Okay, the reason why I'm laughing is because you already see how energetic I am. And there was once a time that I had a mentor during some kind of a sales team, and she had a bit of a like low self-esteem, and she had a difficult relationship with her boyfriend. And he was like, look at you trying to be someone, you think you're someone. And I was like, yes, you are someone. I shook the heck out of her and I yelled at her. And like, to me, I came home like, I did that. And then like later on that night, my supervisor was like, hey, you know, like Sammy said that you yelled at her. And I was like, it was inspiring. I was inspiring her. She was like, she kind of got scared. I was like, you know, so even though the rationale was right, I didn't get the performance right. And if I didn't have a good reason for shaking her when he came in, it would have been totally different, right? So that's why I'm just laughing about it. Like some individuals, they when their family comes in and they're like, how you doing, grandpa? They're like, horrible. These people never feed me. That's happened. These people never feed me. I'm starving. And then you go in and they're like, oh yeah, why is my dad saying he's never been eating? One diagnosis says, do you remember that he has, cognition issues that he doesn't remember? And luckily, here's some notes. This was his lunch because we recorded it. Because why? We knew this was gonna happen. CYA, cover your butt. And I keep saying CYA because I want you to understand what it means. All right. So are there any other questions when it comes to this? Because I want us to start giving examples of what they look like. Right? Let's see. Let's see some examples for nursing processes, and I'm gonna want to start having some some answers. Either you can type it or you can yell them out. Okay. So let's see. If I'm sitting here like this and I come into your office and I'm like leaning forward, I don't know, I came to you because I can't breathe properly unless I sit like this. Like, what do I do? And as a nurse, you're like, oh, okay, so you're not gonna document patient. Well, you can definitely, but eventually you're gonna have to simplify it, not simplify it, just you can say patient is sitting forward, hunched forward, reports inability to breathe properly, da 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 da. So then that's your objective, subjective situation, right? And you're looking at his O2 and the objective, subjective. But now that we're here, we're going to be saying something like ineffective breathing patterns. Ineffective breathing patterns related to pulmonary insufficiency. Because at the moment, you can't see through him. You don't know. You can say related to, like me, when I used to sit like that when I was 13. And my best friend had 3 cats. I didn't know I was allergic to cats. So at 2 in the morning, if you know about the history of asthma, your cortisol levels, unless you're upset and in the middle of the day someone pisses you off, your cortisol levels and your steroids are usually at highest in the middle of the night when your body's fighting to recover itself. So at 2 o'clock in the morning, 4 o'clock in the morning, you would tend to hear children waking up out of their sleep like, that's asthmatics. But me, it happened because I slept over my friend's house and I woke up like this to a cat just looking at me. I mean, I love the cats. The cats love me, but they're taking my breath away in the middle of the night. So, that would be an inefficient breathing pattern related to allergy to cats. But when I was younger, we weren't doing nursing diagnosis that way. So they, instead of saying, well, the next step is to treat it, we're island. So they put me in front of a fan and just said, concentrate on breathing. And I did, and that's how I made it today. But yeah, so you definitely need to make sure you diagnose and treat these people properly. You don't want to have to deal with that. You can also say ineffective breathing patterns related to, pulmonary insufficiency, evidenced by. So, oh, right here. This is the formula. Can we see here? Yeah. So problem, P. Oh, this is cool. Okay, we're gonna do it this way. Problem plus related to plus definition plus symptoms. Or CC's chief complaint. Okay. Copyright, because I just did this myself. So it says P, which is the problem, plus related to. You always want to put related to. The definition of the issue, plus the symptoms and or their chief complaint. So back to the example, ineffective breathing patterns related to pulmonary insufficiency as evidenced by, oh, forgot that part. As evidenced by, because we are scientists and everything needs to be by evidence-based practice, right? And the sooner you realize this, the easier everything will be, because everything goes through a process. And from what studies have shown, when people go off the process, off the beaten path, they first would call them, crazy or a quack. But then once the process has been proven multiple times, that's when it's been given the respect of science, repeatable situations, right? Once again, problem related to definition as evidenced by the symptom, which is intercostal retractions or the need for ongoing oxygen support. Simple. And we did it. So a few times we were in the hospital, or I was in this hospital, and there wasn't enough oxygen tanks. There wasn't enough oxygen tanks. So people would be switching around, like, or we would have to order more, whatever. I'm not gonna tell you the name of the hospital because no one's gonna check. So this is they didn't have all the oxygen tanks for individuals, so some people just wouldn't have all of them, or they would just turn the down or something like that, or some people would some nurses actually hoarded it. A big thing in the hospital, nurses like, hey, this is my patient, you're not gonna have my patient suffer. I'm gonna hoard it, hide it, mine, but whatever, you're not allowed to do that. So then here's the supervisor, and they walk into the room and they're like, this patient doesn't have a diagnosis or an order for oxygen. Why is there an oxygen tank in the room? And if you can't explain it, then they're going to take your oxygen tank. You don't want to be like, oh, I'm saving it for Miss Johnson. You can't do that. So that's another reason why all these diagnoses are necessary. It's going to ration out every step of your movement this entire time. You're going to be doing this, right? So let's lock these things in. All right. That's definitely going to be something that's going to be on your nursing boards. They just want to know if you have, because this is common sense. They're going to want to know if you have this common sense. There's a baby that is throwing up his meals, and the mom presents, what's the nursing diagnosis? Can anyone tell me? There's a baby, the mother just came in with a baby, and the baby, every time he eats, he throws up, projectile vomiting. And the mom knows that the baby's dehydrated because the baby's not crying anymore and the baby is barely even peeing anymore. So what do you think this diagnosis would be? Somebody.
Electrolyte imbalance,
Related to?
vomiting, projectile vomiting, and not taking in.
Not taking. Okay, that's awesome. What's another one? Anybody? Oh, pyloric stenosis. Yes, Mary. Pyloric stenosis. That's exactly what I was thinking about. Pyloric stenosis. That's where in the digestive canal, wherever it goes, please don't write these notes down like this. But yes, as the baby is swallowing, there's a blockage in the either the esophagus or somewhere between the stomach, where the baby will just projectile vomit that stuff back up. If not treated, of course, the baby can perish. But what I would say immediately, yes, there's electrolyte imbalance because I'm an IV whiz, and I'm like, electrolyte imbalance. I would also say, because it's a baby, it's a growth, like a growth deficiency related to, because they'd be like, oh, she's been doing this. I thought this was normal, but now like she's getting smaller. And as a baby, they're supposed to double in size every week. And now this baby's smaller. Yeah, they're having growth development issues related to inability to take in nutrients, nutritional imbalance, electrolyte imbalance, and we can just, the list goes on. The list goes on. Please try me. Give me a this is my patient now. This is my patient. We're taking care of her. I have the diagnosis. Don't worry about it. We will do this together, But if the first step is like, oh, this baby has I'll be right back. And they're like, cool. Whoever you bring, make sure they stay, because this is not happening with my baby, So I love this. This was great. If there's any questions, please feel free to put it here or add it into the discussion post for the class. I really do enjoy reading a lot of everyone's posts and how they're informing me of how they're learning things. Feel free to use a reference citing, because the higher you get in your level of academics is going to be required. So it would be nice to see some of that, just a little try. If you don't know where to go, I used to use Citation Machine, and it looked like a little squirrel. But they're getting to be like Wikipedia, and they're like making me watch commercials and all this stuff. So, and then now they're just asking me for straight up money. And I'm like, Not today. So there's another one called, I think it's called like, it's an orange one. Scribbly, something like that. Scribbler, SCR, I'm gonna spell it, SCRIBBR, something like that. If you go on there, just take off the link, put it in there, it automatically makes it for you, you know? Why? Because the same reason why Google is pissing me off right now is their new update. And yes, iPhone, I'm talking to you. It pisses me off because I don't like it when I say something like, what's the Nanda, or like, what's the Florida law for treating a minor, right? And then I'll put it in Google, and then the Google will take all the pages, like the top 4 pages, and then it'll crunch it all up and then just put it up there for me and be like, here you go. Don't even have to open a book. But that's not how I roll, because the way I open my mouth is, I heard this, I read this, someone once said this. I'm not just going to come out of nowhere and be like, oh yeah, the sky is blue, I heard. Who? Heard from where? Heard from who? I'm going this way. I don't listen to people like that. So whenever we're talking about information and where you got it from, I go with .org, .gov, things like that. Because as we can see from Wikipedia, anybody could put something on a website. And then before you know it, this website says the sky is green. Because in, Dragon Ball Z, if you go into Panic Namek, the sky is green. That's a real thing in Dragon Ball Z. But it's yeah, if you were to, so now it's over here getting information from the Dragon Ball Z site and trying to tell you that the sky is green. It's also known as, what is it called? Technology delusion or something like that. Something that AI is doing, where that's the way that you know that it's not real, because even though it looks so real, there's just something off. There's like a picture of a police officer, and like the police officer has clown shoes or like a weird colored, it always does that. But that's why it's really important for me to understand where you're getting this information from, because I don't want to call you wrong. I want to call your sources wrong. I'm like, oh, so where'd you get that? Where'd you get that from? Because I think I have something else better for you to look at. And then it can make this entire conversation way nicer, instead of, that sounds dumb. You don't want to say that to somebody. Whoa, why are you coming for me? So it's going to be a really great idea going forward, references, and we can talk about it. So this was the class for today. Thank you guys. I will talk to you next time. Bye.
Bye, Teresa.